Hi, I'm Siobhan O'Neill. I'm the Mental Health Champion for Northern Ireland, and September the 10th is World Suicide Prevention Day. To mark it, I've asked colleagues from the main groups who work in this area to tell me about their priorities for suicide prevention in Northern Ireland.
Why is our mental health important, and why is the new mental health strategy important to us, our families and our community? Our mental health is how we think about things and feel on a daily basis. If our mental health is good, we feel happy, we feel well. If we experience mental health problems, we may feel angry, stressed, worried. That's completely normal. It's part of who we are. We all have mental health the same way that we have physical health. And sometimes it's good, sometimes it's not so good. If we are experiencing mental health problems that are beginning to overwhelm us, that are staying with us for longer periods of time, then it's probably a good time to speak to someone. Tell them how you're feeling. And in the same way, if you see someone close to you that may be struggling, don't be afraid to talk to them. Ask the question, are you okay? And listen to the answer. Why is the mental health strategy important now? It's important because it sets out a 10-year plan on how the Department of Health intends to make mental health services better for us all. The plan wants to help everyone have good mental health. It wants to ensure that people who need help can access it in a timely manner. It also wants to look at new ways of working and, importantly, involve people who have experience in using mental health services to help make those services better.
If you are having thoughts about hurting yourself, that's your mind and your body asking you to seek help. So please listen to it and talk to someone. Don't be put off if the first person you talk to doesn't take you seriously. Keep going until you find the right person and the right service for you. That's why we have different services, because we all respond to help differently and we all need different types of services. So please remember, there is nothing so awful that you can't talk to someone about it. And I want you to remember that the world is a much better place because you're in it.
At Pure Mental, we believe it is very important that all young people are aware of how to manage a situation where someone is feeling severely depressed or suicidal.
Where it is ultimately the responsibility of a professional to handle the situation, it is important for young people to take the first step and engage in the conversation that may prevent someone from taking their own life.
Use direct questions.
This does not put the idea in the person's head.
Although it may be uncomfortable, the question needs to be asked.
Once you address the problem, you can start to improve the situation.
Fortunately, I was asked if I was okay, and I had said no, that I wasn't. So I was directed then to the mental health services, which provided me with the support that I needed at the time to help me deal with my suicide ideation and just help me enter into a life of recovery and better mental health than I had at the time. So thankfully I am moving into my 15th year of sobriety, and the help that I received allowed me an opportunity to grow and to survive, but also to thrive now to the life that I live today. And that gives me opportunity to give back some of what was given to me and the help that I received. So this is why I then continue to support the Family Voices Forum to help those who feel that they could be stigmatised or that it's difficult to reach out, because it is. We know as a community and collectively that there is a lot of stigma around suicide ideation and around suicide, and that's not helpful. So what we're trying to do is to try and be as helpful as we possibly can. So organisations such as Minding Your Head is a great one, where there's lots of information should you feel that this is something that you should need, or that you know somebody else is having difficulties with their own mental health or suicide ideation, that you could guide and direct them then to use that service. There are services and numbers there that are helpful.
Suicide prevention is a government priority in the UK. However, most attention, that is funding, research, training, etc., tends to focus on suicide and self-harm, with many professionals totally unaware that caring for those bereaved or affected by suicide is a key aspect of suicide prevention. In simple terms,
Those bereaved by suicide always outnumber those who die by suicide. Yet research tells us that health professionals who come into contact with those bereaved by suicide are often anxious and uncertain how to respond to and care for those bereaved by suicide due to the lack of training.
This year's theme for World Suicide Prevention Day is creating hope through action. It's important we empower people with confidence to engage with this complex subject and to recognise we all have a responsibility to prevent suicide. This year we're seeking to create a movement of preventative action and sustained messaging to ultimately prevent suicide. The COVID-19 pandemic has made us all acutely aware of how our mental health needs must be met as well as our physical health needs. The restrictions placed on our daily lives and routines have meant that for many of us, loneliness and feelings of anxiety may occur. I wish to reinforce that there is support and help available to anyone who needs it. No one must feel that there is no other option. Suicide deaths are preventable. They are not inevitable. The feelings that drive suicide are often temporary, and with the right help and the right support, people can get through a suicide crisis and can recover. In Northern Ireland, there are a complex mix of factors which require a society-led response. This includes better mental health awareness and protecting and enhancing personal mental health and well-being. The Protect Life 2 strategy ensures a cross-departmental approach to reducing suicide. The Protect Life 2 strategy highlights that compassion and kindness give us hope for the future. And I would urge you all to treat everyone with empathy and compassion, no matter what they are going through. Encourage and support anyone you know who is struggling, and please signpost them to the services which will help. This simple action in itself will create hope for those most in need and will prevent suicide. And remember, the Lifeline helpline on 0808 808 8000 is available at any time of the day or night should you or a friend or a family member need it.
The theme for World Suicide Prevention Day is creating hope through action. And I wholeheartedly endorse this sentiment. I firmly believe that ensuring the best possible mental health outcomes for everyone in Northern Ireland is not just about words and platitudes, but also about action. The publication of a new 10-year mental health strategy in June provides us with a clear roadmap for the much needed reform of mental health services. Our crisis services exist to provide support to some of the most vulnerable patients in a very difficult time of their lives. I recognise that crisis services in Northern Ireland have to improve, and that is recognised in Act 27 of the strategy, as well as Protect Life 2. A review of crisis services was carried out in early 2021, and the review report has been published. The new policy for regional crisis services in Northern Ireland seeks to provide a regional approach to mental health crisis, where people get care and treatment when they need it, where they need it. It's a policy that focuses on the needs of the person rather than the system, and this is a new direction for crisis services. A regionally consistent crisis service will be established that will provide effective help and support for people in a crisis. One of the key themes of the mental health strategy centres on promoting mental well-being, resilience and good mental health across society. There's a role for all of us here in creating hope through action. We need to encourage an open dialogue about mental health. We need to take that first step and start a conversation with someone we are worried about. It's about reaching out, asking, listening, talking and maintaining that important conversation.
Thinking about the theme, the triennial theme now for World Suicide Prevention Day is creating hope through action. And I suppose the key message for me as president of YASP, of the International Association for Suicide Prevention, is this idea that we all can do something to create hope. And by creating hope through action, through our actions, no matter how big or small, we could either help start a life-saving conversation with somebody, and that creation of a life-saving conversation, that sense of connection or helping somebody else feel less alone could contribute to saving a life.
On World Suicide Prevention Day, we remember the precious lives we have lost to suicide and all those who suffer suicidal distress. I want to thank the courageous groups and individuals across Northern Ireland who work tirelessly to prevent suicide. My priorities for suicide prevention in Northern Ireland are, of course, that we need to provide full funding for the Protect Life 2 suicide prevention strategy and for our new mental health strategy. Suicide prevention needs to be a priority as we emerge from the pandemic. We have many more people who have suffered trauma, distress and isolation in the past year, and our communities have struggled with loss, bereavement and illness. Suicide prevention means looking after the vulnerable. It means early intervention and accessible mental health services. It also means supporting one another to access crisis services. We must also promote inclusion and equality and support those universal interventions that address social inequalities. Suicide prevention is everyone's responsibility, and together we can make a difference.